welcome to our session for my lovely patient. We are doing, a couple few injections that our goal will be just to really rejuvenate her. She's beautiful, and she hasn't had any treatment done in a while, and
Long time.
Yeah, it's been a while. And how old are you?
Oh, 51. I'll be 52 March 3rd.
Okay.
So you can send me presents.
Of
This
course.
is the best present, actually. Don't send me anything.
So basically, for my lovely patient, our goal will be just correcting the area that she has had some volume loss. So go ahead and turn this way for me. So one of the assessments we can do for our patient is really having them turn to right or left or different angles. So I'm going to show you guys one of the very main ligaments of our face is mandibular ligament. Mandibular ligament is responsible for really connecting the skin, fat pad, muscle to the bone. So that's a true ligament. We call it osteocutaneous ligament. And what happens is, as far as the pre-jowl sulcus, this is our deep fat compartment. And as we get older, one of the things happens, we do lose fat pad in that region. So the beauty of replacing this volume loss with filler, basically we're trying to camouflage. If you take a look closer, we can almost describe this as a hills and valley. There's a depression and there's a projection. There's a little bit of a depression here. So by placing a dermal filler and a pre-jowl sulcus, we're going to enhance her lower face, and then by placing some filler in the back of the angle of the mandible, we're going to contour her lower face and give her some support. And now go ahead and look straight for me. We age from top to bottom, as our neck is the thinnest part of our skin. And also keep in mind, we want to move our neck around. So in order to do that, we do have excessive skin to begin with. Therefore, we can move our neck. Even though some of the patient, after a neck lift and a liposuction, in order for those patients to maintain the quality of their neck, it's super important to maintain those results with non-surgical treatment, which can be skin tightening. One of the skin tightening that we use in our practice is Morpheus 8. It's a combination of microneedling, radio frequency, by targeting the second layer, which is the dermis, and by forcing the skin to build collagen. Keep in mind, guys, one of the things that we want to do is also assessing underneath the skin. Under the skin is the thinnest skin of our face. Go ahead, turn this way for me, close your eyes. Be mindful also the upper eyelid, we lose a lot of collagen. So it's so important for us to educate our patient that in order to improve or maintain the quality of the skin under the eye, above the eyelid, go ahead and open your eyes. One, by using medical graded skincare. Two, by constantly, at least 3 times a year, maintenance skin tightening. All right, so we covered a little bit about skin and how important that is in the aesthetic. So what I'm going to do is, our treatment plan will include, one, bringing some projection to her lower face. We're going to be correcting her pre-jowl sulcus and also helping to lift the corner of the lip. And then by supporting her jawline and contouring her lower face. And also next, I'm going to give her a little bit of support by supporting the lateral zygomatic bone. One of the main reasons that patients end up having a very heavy nasolabial fold is due to the deep fat compartment being shifted downward and pushing some pressure on this region. So by pulling this area backward, by contouring her lateral zygomatic bone, we're going to create a more like lifted and V-shaped look. Also, one of the things we can do is softening the smile line. Go ahead and smile for me and relax. So keep in mind, smile line is just from repeating the same motion over and over. For some of the patient, if they're not looking for lip projection or lip augmentation, we just want to go ahead and hydrate the lips by placing product with the low G prime, like Juvederm, Vobella, or Restylane Refine, that has a low G prime, softer product to hydrate it. And as far as a risk factor, we want to pay attention to our facial anatomy. Facial artery runs in this region and it goes all the way up and it runs to angular artery. Safety is important. So every time you inject the patient, especially with dermal filler, you do want to aspirate, and in some cases we want to use cannula. All right, guys, so first thing I have numbed my patient using 1% Lido just to numb the area. I'm going to use cannula for her. I'm going to use a 25 gauge cannula. As far as creating your entry point, just pull the skin, be as gentle as possible. We want to make sure that the patient is numb, the patient is comfortable, and obviously comfort is super important. So I'm going to let my needle sit there for a second to make sure that when I advance my cannula, I don't have any resistance. I'm going to come out with my needle. Hi everyone, Nurse Yalda. I want to thank you guys for all your love and support and following our YouTube channel. So just to let you know, for more information and having the full access to these videos, you guys can click on this link, which is Nurse Yalda virtual platform. I have all the educational video that you guys need for running a successful practice and being a better provider, a safer provider at Nurse Yalda virtual platform. I'm so thankful and excited for all the love and support.